A Pap test, also called a Pap smear, is a simple and important test that checks for changes in the cells of the cervix. It's used to screen for cervical cancer and is a key part of staying healthy. Doctors recommend starting PAP test between the ages of 21 and 25. Anyone with a cervix should get screened, no matter your gender identity, sexual orientation, or sexual activity. The cervix has two types of cells: squamous cells on the outside and glandular cells on the inside. A Pap test collects a small sample of these cells to check for any changes or abnormalities. Sometimes a Pap test can show abnormal results. This means changes were found in the cells of the cervix. Some changes are minor and may go away on their own, but others are more serious and need further testing. The two most serious results are called high-grade squamous intraepithelial lesions, or HSIL, and atypical glandular cells, or AGC. These changes could mean there's a higher chance of precancer or even cervical cancer. HSIL means the squamous cells on the outer layer of the cervix look very abnormal. This result suggests a higher chance of precancer, and it needs to be checked quickly to make sure it doesn't progress to cervical cancer. If you have HSIL, your doctor will likely recommend a colposcopy. This is a closer examination of the cervix to check for any areas that might need a biopsy. If precancerous cells are found, your doctor may perform a simple procedure called LEAP. This removes the abnormal area of the cervix and helps prevent cervical cancer. AGC, or atypical glandular cells, means the inner cells of the cervix look abnormal. These cells could also come from other areas, like the uterus, and may suggest a higher chance of precancer or cancer. If your results show AGC, your doctor may recommend further tests, like a biopsy of the uterus lining or a pelvic ultrasound, to check for any abnormalities in the cervix, uterus, or ovaries. In some cases, if precancer is suspected, a larger biopsy, called a cone biopsy, may be done to remove and examine more tissue from the cervix. In rare cases, Pap test can detect squamous cell carcinoma, the most common type of cervical cancer. If this is found, a biopsy will confirm the diagnosis, and your doctor will talk to you about treatment options. If your Pap test shows HSIL or AGC, follow-up care is very important. These results don't always mean cancer, but early testing and treatment can stop cancer from developing. Getting regular Pap tests and following up on abnormal results can save your life. Early detection makes treatment easier and more effective. Talk to your doctor about cervical cancer screening. Take charge of your health and protect your future, because you deserve it. Your health matters. Stay screened, stay healthy.